They wanna know what an American warrior is. Yeah. Anybody that served in the United States military honorably.
Welcome, this is the American Warrior Radio Show. I'm Garen Cohn, an Air Force veteran, founder of AVAT Project, and also an accredited claims agent before the VA, and your host. If you or someone you know has ever worn the uniform of the U.S. military, you're in the right place, American Warrior Radio Show. So grab a pen and paper and strap in, because we're about to launch this episode.
Yeah, American warrior. Okay, let's get it in for the women and servicemen. I came prepared and brought my game like ESPN.
American Warrior Radio Show's bumper and intro music is graciously provided by none other than war hero himself, Stephen Hobbs. Thank you, Stephen. Set the tone, my brother.
By the way, I keep the fams buzzing. I ain't worried about the outcome, the message gon' be clear. You can hate it or love it, but your freedom is still here.
Hello, everybody. Welcome to American Warrior Radio. We have a very distinguished guest for you on this episode. None other than what I would have to say world famous Dr. Joseph Rosado. Hi, Doc. How are you this morning?
I'm excellent. Thanks for asking. And thank you for inviting me.
Well, it's an invitation that's long overdue, and we're happy that you're able to share some of your time with our audience, because you cover a wealth of issues, but the one that we're going to speak specifically about is this plant-based medicine. But before we get there, Doc, for the benefit of our audience, can you give a little biographical information, where you're born, raised, schooling?
Sure. I am what's called a New Yorican. What that means is I am first generation mainland Puerto Rican. My parents emigrated from the Commonwealth of Puerto Rico in shortly after they were married in 1959. And I was born in New York City in 1962. And the rest pretty much has been history. After I grew up in New York, relocated to Central Florida, and then from Central Florida, I've lived pretty much all over the United States for schooling or work. I've traveled abroad. I went to medical school in the Dominican Republic. That's another story in and of itself. I've lived in Costa Rica, was one of the team doctors for the Costa Rican Institute of Sports and Recreation, as well as the junior, senior Olympic teams, Special Olympic teams, as well as some of the national soccer teams, or football, as is correctly stated. And so just a host of things. As I stated, I went to medical school in the Dominican Republic because medicine was, in essence, I
was going to ask you about this, because as people investigate you on the web and see some of your biographical, share a little bit about that. It's interesting.
Well, at the age of 15, my high school was offering a nurse's aide CNA course. And I figured, okay, let me do it. And at that time, at the age of 16, you can start working as a certified nurse's aide or an orderly. So I did my training at the age of 15. Once I turned 16, I took the exam, passed it, and then became an orderly and worked as an orderly in an assisted living facility in Apopka, Florida. So I did that for a short time because I was the only guy working in a nursing home. So what was my job? Rolling the clients to avoid the bed sores and or lifting, while the nurses or the other female CNAs would come in and change diapers and change sheets, etc. And so
very important function. But nonetheless, I have to gear my next question to this. So from a very early age, you were motivated to go into medicine. Is that what I'm hearing?
Oh, yeah, totally. I knew I was going to be a doctor at the age of 3. And wow. in my book, Hope and Healing, The Case for Cannabis, that's an Amazon bestseller, I tell the story of...
That again, Hope for Healing.
Hope and Healing, The Case for Cannabis. Available on Amazon. It is available hardcover, paperback, audio, in English and in Spanish.
I have not read it, but I encourage everybody to get a copy, and we'll definitely include a link so they can go right to that.
Sure. So at 16, I started as an orderly. Then from that nursing home, I went to a local hospital, worked as a transportation orderly, transporting patients from their rooms to the X-ray department and back again. At the age of 18, I left the country to go to school. I went to Mexico, became deathly ill, returned to the United States. It took me a year to recover from everything that I suffered there. Went on, became an EMT, then an EMT paramedic, worked at an ambulance as an EMT paramedic, and then got burnt out working on an ambulance. So worked in the hospital as a cath lab technician, did that for about a year and a half, was involved in a very severe auto accident, went to a chiropractor, changed my life. And as a result of that auto accident, seeing the chiropractor, I decided to go to chiropractic school, not medical school. Went to chiropractic school in Marietta, Georgia.
Palmer.
Graduated Life College in Marietta, Georgia, or as they say in Marietta, Mayretta, in Mayretta, Georgia. Graduated in 1992. Practiced for 5 years. Got frustrated with the limited scope of practice, and then went on to medical school, which is why I went to medical school in the Dominican Republic, because my twin daughters were born in April of 1996. I had a family of 4 with 1.5-year-old twin daughters, and the schooling here in the U.S. versus going to school abroad was a lot less expensive, going abroad and being able to support my family. And so I opted to do that.
Obviously, your medical degree counts as much here as there. A lot of people might discount going to Grenada or one of the islands in the medical schools, but your medical practice, what scope do you have? Where do you serve? Where's your emphasis?
Well,
the plant-based.
By trade, I'm a primary care physician. However, in my course from 2001, when I graduated, 2001, when I graduated medical school to present, I've embarked on multiple areas within medicine, whether it was sports medicine, working with the team as a team doctor with the teams in Costa Rica, or doing functional and regenerative medicine now using platelet-rich plasma and stem cells, doing bioidentical hormone replacement therapy for men and women that are going through menopause and andropause, doing medical cannabis, engaging or starting and considering the use of ketamine for post-traumatic stress disorder, treatment-resistant depression, suicidal ideations. So, I've broadened my area within medicine to offer the greatest amount of good for the public that I serve. All of the clinics that I've ever, all of the clinics, all of the populations that I've served have always been in an underserved, underrepresented area within the state of Florida. So all my populations in every clinic that I've managed have been designated areas of critical need to address the need of the underserved, underrepresented.
Wow, Doc. First of all, I lost count as to how many careers you have ventured, and that's awesome. It's given you this wealth of experience, and not just in medicine and what have you, but also people and personalities and the way we deal with illness and what have you. The interesting thing is that the medical doctors of today, generally speaking, are into this allopathic model where they're just going to write a script and treat the symptoms. Based on several of the things that you talked about, you're much more interested in a curative approach rather than treating symptoms. Is that about right?
That's about right. And that comes from my training as a chiropractor. There was a philosophy from one of the individuals whose techniques I learned, Clarence Gonstead, a pioneer in the chiropractic world, based out of Mount Horeb, Wisconsin. And he had a philosophy that, or a phrase that was coined to him that was, find it, fix it, leave it alone. And it's like you find the problem, you fix the problem, and you leave it alone, and then you let the body do what needs to be done. And in the chiropractic realm, we talked about the innate intelligence being a part of the universal intelligence, and the power that created the body heals the body. And so I still have that to an extent. Now, are there times where you need some type of a synthetic medication to address? Absolutely. Is there an emergent or urgent need that you have to address immediately? Absolutely. But when you're looking at chronic conditions, chronic care, and you have an individual that's been on an antidepressant or multiple antidepressants for 5, 10, 15, 20 years, and they're still depressed and they're still anxious and they still have insomnia.
Yep.
It's time to reevaluate and let's look at an alternative and support that individual rather than just throwing more medications at them and the fear of having them suffer the side effects and adverse effects of many of those medications.
For certain. Now, you mentioned 2 episodes in your life, the car accident, which obviously motor vehicle accidents can wreak havoc on the body, and also your trip to Mexico. Those 2, how did you best cure that? How did you get past those?
Well, the situation in Mexico, I was 18 years old, and when I got there, I contracted salmonella, shigella, amoebic dysentery, typhoid fever, contracted a kidney infection, and in the 30 days that I was there, I was in the hospital throughout my time there, 7 days total. But it was like 2 days, then 3 days, and like in between. And towards the end, one of the professors there went to the physicians at the hospital and said, "Look, I've ingratiated myself with this child because I was an 18-year-old boy. I've ingratiated myself with this child, and his parents have, in essence, tasked me to keep an eye on him. What do you recommend? What do you think?" And the physician said, "Do not get involved. We're waiting for him to break his fever from 105 because it's 40 degrees Celsius, which is equivalent to 105. Yep. They said, we're waiting for his fever to break 40 to 39. And once it breaks, we're packing him up and sending him back home because he's not going to die here. We want him to die in his country." And that was the mindset. And so when I got back to the US, my mom and stepfather picked me up at the airport, took me directly to my primary care physician's office. He immediately admitted me to the intensive care unit. I had lost an incredible amount of weight, was severely dehydrated, and I had IVs in both arms, massive doses of antibiotics and nutrition and just all kinds of things to build me up. And then my mom was starting to get involved in the whole natural movement. My mom's a vegan right now. She's a naturalist. And so she began to look for different herbs to build up my immunity and also to build up my anemia, because I became extremely anemic because of the amoebic dysentery. I was bleeding from my GI tract, and so I was losing blood. And so she built up my immunity and my hemoglobin by making radish, beet, and onion juice.
Oh, sounds delicious.
She was juicing that, and it got to the point that I would perspire, and like I was living at home with my parents, and they would be in the living room. I was in my room, and they could smell the onion coming off of my body. But it got everything up. I normalized. It took me about a year to get back on track, but that was my first taste of natural healing, natural management for disease.
Well, and we're talking some 40 years ago. So your mom was ahead of the curve there as well with this naturopathic way to address illness. And it obviously worked because you're here today. Now, so that kind of set the stage for you to explore alternative methods of medicine. And then you had a bad motor vehicle accident.
Yes, this was in 1987. I was stopped in a Datsun B210 getting ready to make a left-hand turn, and a young man, a 16-year-old, was driving a Delta 88 and dropped his milkshake, bent over to pick up the milkshake. When he came back up, he had left his foot on the gas, and I stopped his vehicle. And it was an automatic. He hit me so hard that it turned off my vehicle. And instantly, I felt this sensation of pins and needles from my waist down.
Oh my.
And I went to the emergency room. They took x-rays, they checked me out. And because of the paresthesia, they started giving me like high doses of steroids to help reduce the inflammation. They did some traction on me back then. We're talking in 1987. And so I still had the pins and needles, had a lot of like gastrointestinal issues because of all the medications that they were giving me. And so I had seen this chiropractor before for sports-related injury. I've been practicing and training in the martial arts, and I was competing at that time. And so I always went to him following tournaments to, get everything put back into place. Well, having followed this car accident, I just didn't feel right, and I felt tired, and I had that numbness and tingling sensation. So I go back to his office, and I explained to him what had happened. So he's like, well, let me get some x-rays again. I said, well, I've got the x-rays from the hospital. He said, well, those x-rays were taken laying down. We take our x-rays standing up. We want to see what is showing up.
In his neck.
Right, yeah, in a weight-bearing state. I'm like, sure, no problem. He does that, and as he's giving me the report of findings, he says, did you know that you have a fracture in your spine? And I'm like, I have a what?
Yeah.
And he's like, yeah. He's like, yeah, come, let me show you. And I was hit so hard that it caused one of my vertebrae to compress, and I have a compression fracture in my spine. And that's where that was the reason for my numbness and tingling and my weakness in my lower extremities. Well, 2 weeks following the accident, I felt better than I did before the accident. And I was all set, ready to go to medical school. I had taken my MCAT, which was the medical college admissions test. And I said, you know what? Forget this. And I decided to go to chiropractic school instead of medical school at that time.
Right. Well, you said something that I think is really important. The normal model of medicine is you go in, they triage you. Oh, we need x-rays. They put you in the x-ray. As you said, a lot of the times you're laying prone or supine, however they do it, but your body's not in its normal state, as you said, weight bearing. That alone is an interesting little point to extract from all this. Just that different perspective, right?
Yep. And so I went out to chiropractic school, got an amazing education, great educators, great mentors, learned everything I could. I became a living sponge and soaked everything in, and then practiced for 5 years, practiced 2 years in Ohio, hated the winters, moved to Arizona, just outside of Phoenix. I lived in Tempe. My office was in Chandler, and then practiced there for another 3 years, and moved there in 94, and late 94, and then in fall of 1997 went to medical school in the Dominican Republic.
A phenomenal story, and you're practicing now, and you've got a wonderful web presence. There's so many ways that people can get a hold of you, but I want to talk now about something specific. Since this is the American Warrior Radio Show and we're all about veterans, we say past and present military members and their families, because when one serves, one member of the family, everybody's serving. We've got a big event coming up to celebrate Month of the Military Child on April 1st. So as bringing the whole together, for instance, I'm kind of rambling, but I'm going to come to a point here, Doc. When a veteran goes overseas and let's say something traumatic happens outside the realm of normal human experience, comes back and they're so adversely affected that they get this diagnosis of an anxiety disorder, namely PTSD. that isn't just going to affect the warfighter, but the spouse and the children, maybe the mom and dad, maybe their coworkers. Everybody's going to notice a significant difference in the way that the person is responding to everyday events. So given that, they go to the doctor, again, your average allopathic doctor, and they'll write a script for, an SSRI or whatever to try and tame some of the symptoms. You, in this wide range of experience, have come to accept that cannabis, medical marijuana use, is a great alternative, maybe not for all, but for a lot. Can you tell me what piqued your interest and what made you first go down that road of investigating the efficacy of medical marijuana?
Absolutely. I'm a unicorn. Less than 10% of medical schools teach anything about the endocannabinoid system, which is the system inside our bodies that produces cannabis. We all,
it's there already. I have it.
It's there
Everybody
already.
has it.
Every animal that has a vertebra, that has a vertebral body, are all have an endocannabinoid system. So all vertebrates have an endocannabinoid system. We all produce cannabinoids. And we have receptors that accept the use, and the external cannabinoids work on those receptors. So we have endocannabinoids that are endogenous, and we have exogenous cannabinoids that come from the plant, phytocannabinoids. And there you have your CBD, your THC, your CBG, your CBN, etc. So while in medical school, in pharmacology class, we're talking about toxicology. And we start with the gateway drug, aka marijuana. And for a very small paragraph, they talk about the endocannabinoid system and the receptors for the cannabinoid system. And then immediately they go into their song and dance about how it's a gateway drug and it's going to lead to all the other harder drugs and blah, 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 blah. Well, I'm a researcher. I'm an investigator by nature. I'm a frustrated PhD. And so I went home, pulled out my Goodman and Gilman, which is the Pharmacological Bible, which is a book that's this thick. And I go in and I research Cannabis sativa L, which is the mother plant. And it talks about the benefits and the receptors and how it works. And
stop right there, Doc. So you say the plant. This grows out of the ground. That's why they call it weed. It couldn't be more natural. Nothing else in the pharmacy is as natural as marijuana. Am I right?
You are 1,000% correct. So that being said, we've got the mother plant, we've got all of the things that come off of it. You've got hemp, you've got the cannabis plant, and then the differences between the two, one producing higher CBD, lower THC, the other one having higher THC, lower CBD, and all the entourage effect. Learned about Raphael Meshulam's work, et cetera, et cetera. Now, granted, this is early on. The first endocannabinoid was named in 1992. I told you I went to medical school in 1997. So I learned about the endocannabinoid system maybe 1999. So we're talking about 7 years after the first endocannabinoid was named. And it was named by the gentleman that wrote the foreword to my book.
Which I'm going to read, and I hope everybody else gets a copy too. If you're interested in this subject matter, we definitely want you to stay tuned because the doctor has agreed to stay with us for part 2 of this, what I think is a very important subject matter. And we don't have a better expert than this gentleman. So Dr. Razak, go ahead.
So I started learning about it there, but I was again in the Dominican Republic, in a country where the cannabis is illegal, still remains illegal. And so I just tabled it. 2010, one of my best friends in Arizona calls me and says, "Hey, Joe, we have a medical cannabis bill in Arizona. It's legal now for medical purposes, but we need a medical doctor to be the medical director for, to open up a dispensary and have this. I've got some property. I want to start growing it and then provide the service for the patients and for the people." I'm like, absolutely. Sign me up. We get involved. At that time, his son and my twin daughters are 14. His son was born 1 to 2 weeks before my twins. So they're very, very close in age. And so we're like, I'm set. Let's do it. Well, his wife, because our kids are about 14 at this time, she's like, I don't feel comfortable getting involved in this when we're telling our kids not to use drugs, not to do drugs. And I'm like, look, this isn't, Jose and Don selling weed on the street corner. This is, Dr. Rosado, Dr. Dearth, providing medical cannabis, but she tabled it.
Dr. Rosado and Dr. Dearth. Yeah, big difference here.
Yeah. So she's like, no, scratch it. So that was 2010. So fast forward 2014, I'm in Florida watching TV on a Sunday, and I see John Morgan, one of our most prominent attorneys in the state, advertising for Amendment 2, the decriminalization of cannabis for medicinal purposes. I send him an email and say, I'm a physician, I'm an advocate, how do I get involved? Within 24 hours, he puts me in touch with his campaign manager. Campaign manager spends 15 minutes talking me out of it. I'm like, look, forget it. I'm in, let's roll. A week later, I'm on the Bureau of Speakers. November of 2014, it did not pass. We had to get 60% of the vote. We got a little less than 2% from hitting that 60% mark. So we went back to the drawing board and went back on the ballot in 2016.
Powerful lobby opposed to it. You have to put that in there. Very powerful, well-funded lobby opposed to the decriminalization.
And so we fast forward to 2016. It passed, with a resounding 72% yes vote. And because I was already in the movement, I was fortunate enough to be the first in the greater Central Florida area to recommend medical cannabis in August of 2016 to a 35-year-old female who had a brain tumor. And then in November of 2016, 3 months later, I was the first in the state of Florida to recommend cannabis to a 15-year-old who had cancer of the head and neck. And that made state news. I was in the paper, all the local newspapers, radio stations, social media, etc. And that my practice boomed, and people were driving from the Panhandle, coming up from Miami to have me see and manage their children. Back then, there were less than 20 doctors that were certified to do it. Now there's a little over 2,500 doctors certified to do it, but there's 55,000 licensed physicians in the state of Florida, and a little over 2,500 of us are certified to recommend. And I'm still one of the few in the state that will manage and treat children.
I just wanted to say that for those that are interested, there's a wealth of information and videos from other interviews the doctor has done. You can track his progress and his advocacy for this, what I term a very important change in the way we address chronic illness and even the neuropsychiatric disorders. So, folks, don't go anywhere, because if you stay tuned to American Warrior Radio Show, we're going to bring you more of Dr. Joseph Rosado, who is an expert and an advocate for plant-based medicine. In particular, we're talking about the medical marijuana. So join us next time where we continue with part 2 with Dr. Joseph Rosado on this very important issue that I know you will want to hear about and share with others. So until then, don't forget, thank a vet. Hi everyone, it's Garen Cohn with American Warrior Radio. I'm here with my good friend Christian. We're here to deliver a very important message about a crisis in our land.
Suicide prevention, more specifically, veteran suicide prevention.
22 a day are taking their own lives. This must stop. This can't continue. If you or someone you know is contemplating suicide, please know that God has tomorrow planned for you. Don't take your own life. And just remember, suicide is a permanent solution
to a temporary problem.